The total number of confirmed coronavirus cases in the United States has passed the 30 million mark. This is according to Johns Hopkins Coronavirus Resource Center. This is as new infections continue to trend upward in a majority of states, despite the escalating vaccination campaign. As cases surge, health experts say it might be because of the rapid spread of new variants of the virus. Dion Ibeke is a medical doctor at Bloomington, Illinois, in the U.S., and she joins us right now via Zoom. Finally, good to see you. Thank you for joining us on the program.
Hi, thank you for having me.
All right, Doctor, why do you think the U.S. is still recording more and more cases while it continues its vaccination drive?
Well, as you mentioned, we have new variants. And we have the UK variant, the South African variant, just to name a few. And those are more contagious and spread more rapidly. Unfortunately, we can lead to more hospitalizations. The other thing is that we've been in this pandemic for a year now, and people are having fatigue. And so, they're laxing on their public health measures like wearing a mask and social distancing. They're gathering more. They are traveling more. So that's leading to some spread of this virus. And then we've had states have premature measures that they've taken to lift mask mandates and open to full capacity. And what that does is it allows individuals to, again, become more lax on their day-to-day public health measures. It's unfortunate because Biden announced that as of May 1st, all Americans will be eligible, 16 and older, will be eligible for the vaccine. So, I just wish they could just wait a little bit longer before making those measures for their states so that, we can keep people safe and get that herd immunity that we need to get back to normal.
And, that's really the question. Is this the best time to roll back restrictions? Because, it appears a lot of people are really tired. But then last week, President Biden did talk about his plans of rolling out even more vaccinations. I mean, doubling his previous targets of 200 million doses by his 100th day in office. Do you see this happening?
Oh, I absolutely do. He originally had the goal of 100 million shots in his first 100 days. He was able to do it in 58 days. So at this rate, I definitely see him getting to the 200 million shots in 100 days. And why is that? We have ramped up production of vaccinations. Johnson & Johnson has now teamed up with Merck, thanks to the Biden administration, to increase production. And that's going to be added to what we already have with Pfizer and Moderna. We also have more vaccination sites. We've become more efficient at administering vaccines for the population. And then additionally, people are more receptive. Before Biden got into office, in November, we had about 60% of people say that they would get a vaccine. Now that number has increased to 70%. So when you combine those three factors, we'll definitely see an increase in the rate of vaccinations in the United States, which is great, which is beautiful news.
As a medical doctor, I'd like to get your thoughts on the AstraZeneca vaccine. It's pretty much been having, some would say, call it a bad press situation. The overall attitude to it in some areas, maybe like Germany, we understand some healthcare workers prefer the Pfizer-BioNTech. But what are you hearing in the U.S.? I know it's not been approved yet for use.
Yeah, so as you mentioned, the AstraZeneca vaccine has not been approved for use in the United States. The bad press is unfortunate. It sounds like they were a little misleading in terms of the efficacy data. They were touting a 79% efficacy, but when the internal review board looked at their data, it looked like the numbers were closer to 70 to 74%. Really not that big of a difference. And 70 to 74% is actually really efficacious. That's a good vaccine. But when you have discrepancies like that, even if it's minor, that leads to distrust in the public sphere. Vaccines in general, people are hesitant to take them. So when you have bad press like this, it makes people less likely to want to get the vaccine, not just AstraZeneca, but it affects other vaccines that are already in the market. I do think that this whole story is a testament to how rigorous, the FDA and other organizations are in holding these pharmaceutical companies accountable. We don't just take them at their word. We do our due diligence to make sure that their data lines up before we ever, provide it to the public. But like I said, it does sound like that AstraZeneca is a good vaccine. They just have to iron out a few kinks.
Before we let you go, you've received your vaccine and your latest mom, congratulations. And you're also nursing your baby. So how did you make that very bold decision?
Well, for me, it wasn't a bold decision. For me, it was a common sense decision. I am a healthcare worker. I'm an anesthesiologist. I'm high risk. So for me, that vaccine was another weapon in my toolbox to fight against this disease. Every day I go to work, I'm concerned about what I could bring home to my family. And this allows me to decrease the risk of bringing this virus home. And it also, increases the risk that I'll be there to raise the children that I'm bringing into this world. The American College of Obstetrics and Gynecology, they put out a statement for pregnant and nursing mothers. And what they said was that, yes, they weren't included in the studies, but these vaccines should not be withheld from pregnant and nursing mothers. You have to do a risk-benefit analysis. We know the risk of COVID, especially with pregnant mothers. They're higher risk. They could get hospitalized and they could die. They're higher risk for all of those things. So there has to be a risk-benefit analysis. For me, I was one of my deciding factors to do this as a nursing mom was the possibility of giving some antibodies passively through my breast milk to my baby, which is just another way to protect them. And data, I'm waiting for the data, but there is a little bit that could show that I am doing just that. All I will say for pregnant and nursing moms, I understand the hesitancy. This is a very important time in your life. Make sure you have a conversation with your obstetrician, with your primary care doctor, and make it a shared decision so that you're confident in whatever choice that you make.
We appreciate your time. Thank you so much, Dr. Dion Ibeke. Thank you for joining us on the program.
Thank you for having me.